listen up. If you suffer from chronic knee or joint pain and you're searching for any kind of relief, UC San Diego Health may just have the answer for you. Joining us now to explain all this, Dr. Evan White. Doctor, good morning. Thanks for being here.
Thank you so much for having me.
I know a lot of people out there, their ears kind of perked up when they heard about this. They suffer from this pain. They think there's no relief for them and everything else. Tell me about this new therapy that you guys are offering and exactly how it works differently from other therapies we've had.
Yes, so we're very excited at UC San Diego Health to have a new treatment option for patients with osteoarthritis, and that's low-dose radiation therapy. So osteoarthritis is the most common cause of chronic joint pain in older adults. It affects approximately 32 million Americans.
Wow.
And what happens with osteoarthritis is that wear and tear on the joints can lead to cartilage loss and chronic inflammation. And this can cause symptoms such as joint pain, stiffness, swelling, and reduced mobility. Now, the most commonly affected joints are the knees, hips, shoulders, spine, hands, and feet. And typically patients are treated with either medications such as NSAIDs or painkillers, or sometimes they need to have procedures done like steroid injections or even surgery and joint replacement. But despite all these treatments that we currently have, many patients still suffer from the symptoms of osteoarthritis. And so we're really excited to now have another option, which is low-dose radiation therapy. And studies show that this treatment that we are now offering here to San Diegans, patients have pain relief about 60 to 80% of the time.
Wow.
And the patient is the treatment, I should say, is very safe and well tolerated.
You mentioned, I was going to ask you, is this a pretty common thing, but osteoarthritis, we've heard the name many, and when you say 30 million people, I can't do that math, like 10%, that seems like a lot.
Yes.
But the point being, is it difficult for you to sell these patients on, when you use the word radiation, just the mentioning of that word, even if you say it's low dosage radiation, you show them 60 to 80%, are people kind of freaked out by that a little bit when they hear that? And how do you kind of tell them, no, it's okay, it's safe?
So that is a very common concern that we understand. You know, you hear the word radiation, and most people, what they think of is, you know, we are generally using radiation to treat cancer.
Right.
And the goal with that is, you know, we're trying to kill the cancer cells, right? But with this type of treatment, when we're using radiation to treat arthritis, we're using a very low dose of radiation. And the goal is not to kill anything. What we're trying to do is we're trying to have an anti-inflammatory effect.
I see.
And, you know, when we do this type of treatment, the dose of radiation that we use, it's less than 5% of a dose that we would typically use to treat cancer. Furthermore, when we're doing this type of treatment, we're really extremely precise and targeted, and we're only treating the affected joint. So, for example, the knee or the shoulder. And so what that means is that the patient, you know, the rest of their body, their organs and things like that, it's really not receiving any amount of radiation dose.
And that's important for people to understand.
Definitely.
Yeah.
And so this is a safe treatment. It's a very targeted treatment. And, you know, we know that this treatment is safe because we have long-term data showing that it's a very safe treatment.
I wanted to ask, who is the best candidate for something like this, for this new treatment, and how long is the recovery process?
Yes. So the best candidate would be patients with osteoarthritis in their extremity joints. Okay. Typically, patients we see are over the age of 50. This is most common in patients as they get older. Now, most of the patients that we see have tried other types of treatments. As I mentioned, you know, maybe medications, NSAIDs. They might have had prior steroid injections, for example, in the joint.
It just wasn't working well enough.
Exactly. A lot of patients, either the treatments are not working for them, maybe they used to work, they don't work anymore. Some patients aren't candidates for these other types of treatments either. And so, you know, we think of this treatment, low-dose radiation, it's not a replacement for the other types of standard therapies, but it's really just another tool in the toolbox when patients might need other options.
I mean, it's fascinating. And we were talking that you mentioned this has been happening in Europe for 80 years, so I was just curious as to why it's taken this long to get here if for 80 years it was being used overseas?
Yeah, so it's interesting. This treatment is actually very widely used in Europe.
Right.
In Germany, they treat over 15,000 patients annually. About 1/3 of all patients who get radiation treatment in Germany are being treated for benign diseases, not cancer. And so in the US, the reason it's now starting to gain a lot of traction is in the last few years, we've now had multiple randomized clinical trials that show that this type of treatment, this low-dose radiation for osteoarthritis, is both safe and effective.
And it works. That's the key. Dr. Evan White with UC San Diego Health, thank you. Thank you for everything you do, keeping our joints healthy. Appreciate it.
Thank you.